I'm Mike Royer with an extended interview in this Health Matters Web Extra. Welcome to another segment of Health Matters here on WVUA 23. Joining us today is the Chief Medical Officer at University Medical Center, Dr. Tom Weida, a familiar face on our TV station. Dr. Weida, always good to see you, sir.
Great to be here.
Well, as we discussed before we turned the camera on, COVID, if you're bored by COVID today, stick around because the news will be different tomorrow. What are you hearing these days here as we get near the end of the month? What's the latest headline in your mind about COVID, how we're dealing with it, where we are today?
Well, obviously the latest headline is about COVID booster vaccines. Now, there's a difference between the COVID additional vaccine versus the booster vaccine. So the additional vaccine is for folks who may not have had a proper immune response from the first two doses, whereas the booster is because immunity has gone down over time, and then you need to boost it up.
Like with almost any vaccine, it only lasts so long. We get a flu vaccine every year. The COVID vaccine in that way is similar in that you don't expect it to last for the rest of your life. It's got a limited life, correct?
Yeah, most vaccines usually will decrease over time. Now, they've been considering the booster vaccine. It was looked at this weekend by the advisory panel, and instead of recommending boosters for the entire population, they really are recommending boosters for a select group, which would include those over 65 and those with comorbidities and also healthcare workers. This now has to go to the FDA and then to the CDC for final approval and recommendations.
There was a time a month ago, 6 weeks ago, where it sounded as if we were all of us who are fully vaccinated would probably be getting a booster shot. That's been dialed back, as you indicated, and probably folks that are predisposed to serious health problems, and maybe the elderly might be candidates for that. But for someone like you and me, generally in good health, fully vaccinated, that's not going to happen for us soon, most likely. Is that correct?
Right. It may take a while for everybody to qualify for a booster. Much more important is for everyone to get the primary series. That will be far more effective than just doing boosters for everybody who already got vaccine.
I've interviewed the dean a few times, and he always says, any question you have about COVID, the answer is get the shot. And that does kind of sum it up. We're so far down the road now, we understand the effectiveness of the vaccine. It's just hard to justify not getting it. Is that your view as well?
Very hard to justify not getting the vaccine. I was just looking at some data, and basically 1 in 500 Americans have died because of COVID. When you look at the vaccination, we gave over 300 million shots, and that rate of folks that may have died from the vaccine, not proven, is 1 in 50,000. So if you're a gambling person, which one would you take?
Yeah, it is common sense. You don't have to have medical training like you do to get that kind of understanding. That's just basic stuff. Are locally, through what you hear of local vaccination sites, are we still making progress, or are we kind of in a lull now where it seems that most people that want it have gotten it, or do you see interest still peak up once in a while?
I do see a little bit of interest going up, particularly with the Delta variant.
Yeah.
And actually where we see more people being interested is once they've gotten COVID now, and then they say, well, gosh, I want to get the vaccine. And it is okay to get the vaccine after you've had COVID. It does provide additional immunity.
Some of the saddest stories we've heard are people in the hospital very ill going, can I get the vaccine now? And the answer is no, usually. We've got to get you through this first, correct?
Correct. Once you're in the hospital, if you're very sick, once you have COVID, the vaccine is not going to help you because it takes 2 to 4 weeks to build up that immunity.
Do you expect the vaccine to change going forward? I know we're giving the same vaccine. It seems to be working very well. Will it be fine-tuned by the smart folks that know how to do vaccines, or do you think they've got it about where it needs to be?
Well, with the mRNA vaccine, which is the Pfizer and Moderna, those can be tweaked, and they may indeed tweak them depending on whether there are other variants that the vaccine shows that it may not be as effective. So time will tell whether we need to tweak it or not tweak it.
Let's end with probably a really hard question to ask, maybe not, but do you think the COVID vaccine is going to be sort of with us the way the flu vaccine is. Those of us who believe in the flu vaccine, when they say get it, we go get it. Do you think maybe COVID will be something we'll be dealing with for quite a few years going forward?
I wish I had the crystal ball on that one, because
yeah.
if you look at the previous SARS infection, that died out. And so we didn't have to mount a vaccine campaign for that.
True.
If enough folks get vaccinated across the globe, we may not need to keep boostering this vaccine. On the other hand, I'm not sure how likely that will be, and so boosters may be needed ongoing. It depends on how long that immunity lasts.
So again, the answer to every question is get the vaccine. Even young people, very young children, are now eligible to get it in some places. Will they get the same vaccine adults get generally?
Right now, we're giving vaccine down to the age of 12. Pfizer is on the verge of submitting studies for 5 to 12, which will be at a dosage about a third of that of adult dosages. And so they have some good evidence that it is helpful, that it works, that the side effect profile is reasonable. And so that will be a great saver for infections in schools.
I kind of lied about wrapping this up. I'm going to ask you one more question. If you had a child 5 years old and the science says we've got a good vaccine now for a 5-year-old, would you have any hesitancy about giving that young of a child the vaccine for COVID?
If I had a child 5 years old who's going to school, I definitely would give the vaccine once it's approved with emergency use authorization. No problem about that. I think that it's very effective and that the side effect profile is reasonable. Kids are getting infected. They're getting very sick. They're getting hospitalized. There is no reason not to get the COVID vaccine.
We always appreciate your expertise. Thank you so much for joining us today, and we'll look forward to talking to you again. Thank you.
Thank you.